Good morning, everyone. Thanks for signing in today to watch this webinar called COVID Cover-Ups, Coronavirus Reporting in Iran, North Korea, and Russia. We have a few housekeeping notes that we want to get out of the way first. I believe there will be some information popping up on your screen. This session will be recorded and it'll be available on the heritage.org website in approximately 48 hours. All attendees are in listen only mode. And if you want to pose a question, you can see a question box on your screen, I think to your right. And you can type in your question there and somehow through magic, it'll find its way to me. And then I will ask it if it's family friendly and appropriate. So we have a very good set of panelists with us here today to talk about this issue. I'll introduce them in a minute, but first I would like to tee up the discussion. It is far too early to really know how the COVID-19 global pandemic is going to impact geopolitics. We are already seeing some of the effects right now around the world, a lot of inward focus by countries, worrying about their domestic situations, and rightfully so, allocating huge amounts of national resources to ensure that they can fight and confront this pandemic. But while all of this is going on, there are still countries around the world who were causing problems before the pandemic, will cause problems during the pandemic, and will cause problems after this pandemic. And many of these countries have been a little cagey on how they're reporting the impact that COVID is giving their country, not being very transparent. There's a concern that some of these countries lack the resources to deal with the pandemic, that they have been slow to react. And if we know anything, some of these countries that cause geopolitical instability, when they get desperate, when the political situation or the domestic situation in their countries gets desperate, then they start acting in a belligerent or aggressive way to their neighbors. And the three countries we're going to discuss in some detail today are Iran, North Korea, and Russia. I will briefly mention who the speakers are now, and then I will introduce them again before it's their turn to speak. And then we will go into the question and answer session, which as I said, you are all on a listen only mode. But if you want to pose a question, there is a question box, you can type it in. So our first speaker today, she will focus on the situation in Russia, and that's Maria Snegovia. She is an adjunct research fellow at CEPA, the Center for European Policy Analysis, and we're very lucky to have her join us today. The Heritage Foundation and CEPA do a lot of collaboration together, and it's always great when we come together for an event like this. The next speaker after that will be Jim Phillips, who is the Senior Research Fellow for the Middle East at the Heritage Foundation, and he'll give us an overview on the situation in Iran. And then finally, Bruce Klinger, who is our Senior Research Fellow for Northeast Asia at the Heritage Foundation. So Maria, over to you first.
Good morning, everyone. It's a big honor to be here today. Thank you for having me. So I will briefly provide the situation with covering the coronavirus in Russia domestically, and then also talk a little bit about how Russia covers the situation and spreads disinformation about coronavirus abroad. And what does it mean in terms of our support for the transatlantic community. So as we speak, Russia has about 100,000 confirmed cases of coronavirus and 6,400 deaths total. This dynamic of discovering the coronavirus has accelerated recently, but has not always been the case. As a matter of fact, in early March, and even up until to late March, frankly, the Russian authorities have tried to conceal the situation with coronavirus in Russia and actually hid the information. This is quite normal and frankly frequent response that autocrats provide when faced with unusual circumstances. Russia was not exception, and early on, a lot of commentators and observers actually compared the situation to coverage of Chernobyl explosion, or even better, the sinking of the submarine Kursk, when again Putin actually kept silent about the situation for quite a while. And it wasn't until the Western media started being really puzzled and raising questions about the situation domestically, that the Kremlin was forced to respond. Pretty much the same we have observed until recently in Russia with coronavirus as well. Now, again, there's reasons to doubt the official numbers as of now, even the Kremlin, even if the Kremlin has been reporting them quite consistently over the last month. And the reasons are, first of all, it's not clear that this spike in diseases started in Russia, as the authorities said in early April. There's reasons to believe that the cases were actually spread early on because of the vast Chinese tourism to Russia back in December and even January. Already back then, it has been reported that Moscow hospitals have faced a spike in pneumonia cases, which a lot of observers have attributed to possible impact of coronavirus. In addition, the authorities are not very open about the spread of the cases across the regions, and people who try to raise awareness about this are commonly prosecuted. In Russia, for example, Russia's political analyst Valery Solovey mentioned during his regular broadcast on Echo of Moscow radio station in mid-May that, in fact, Russia at the time already had about 2,000 of confirmed cases of deaths from coronavirus. As a result, this podcast was removed from the Echo of Moscow website under request of the Russian authorities. There's more cases like that. For example, recently the Supreme Court of Russia ruled explained the punishment against people who spread quote-unquote disinformation in Russia. There's also multiplying cases of doctors being prosecuted, and unfortunately, I would actually even venture a guess that we eventually may face the situation reminiscent of the Soviet doctors case somewhat, in the sense that doctors, especially in the regions who suffer from the lack of necessary medical supplies, equipment, and even protection, those of them who try to raise awareness about the situation actually are increasingly persecuted. For example, last week in Rostov-on-Don city, there was a case open against the head physician in the hospital where the coronavirus patient was identified. So it is possible that as it commonly happens in Russia. Unfortunately, people who are on the forefront of this fight against this disease are going to be the ones punished first. Additional complication is associated to the fact that the Kremlin doesn't really have money to sustain Russia's population throughout this crisis. There are some reserves that the Kremlin has accumulated over the years, but it's not anywhere in the rush to, again, waste them on ordinary people, so to speak. Because the Kremlin is visibly concerned about what happens after the crisis ends and with possibilities of Putin's re-election in 2024. Now, because the Kremlin is not supporting the population, and Russia's population has very limited savings and is generally poor, it is unlikely that the country is going to be able to survive this longer-term quarantine. As a matter of fact, as we speak, Putin just confirmed that this vacation, as they're called in Russia, they're not called quarantine, they're called vacation, are extended until at least May 11th. But it is not clear that this situation is sustainable in the long term, since the Kremlin does not provide any financial assistance to people or especially small and medium enterprises, a lot of which are likely to go bankrupt. Instead, there are a lot of sticks, people who live houses, especially in Moscow, where the quarantine regime is much harsher than the rest of the country. Those people are punished, penalized, fined, but there is no carrots, so there's no assistance. People actually are officially taking holidays off, days off from work, but this is only sustainable, of course, for state-owned or state-backed enterprises. The independent businesses are definitely in a dire situation. So because of that, the economic protest is likely to eventually emerge and create a lot of social instability in the country. That's another possible concern. And the Kremlin is not likely to be able to continue this indefinitely. As a matter of fact, according to some rumors, they expect the coronavirus situation, the pandemic, to peak, quote unquote, officially to peak by mid-May. And afterwards, we're gonna likely to see the certain lifting and relaxations of these limitations, regardless of what really happens in reality with this disease, just because the social situation is unlikely to keep stable longer than that. Because the Kremlin definitely controls a lot of information in the country and about this virus, it's not going to be probably too hard to do. But of course, it's definitely going to be very bad for people who will continue getting infected and die from this disease. That's more or less a brief review of what's happening domestically. Internationally, Russia early on definitely tried to use the situation in order to achieve certain longer-term goals that Russia tries to achieve with respect to the United States and Europe. Especially early on, we have seen and multiple institutions that track disinformation coverage have monitored the increase, a spike in disinformation campaign in the West, designed as usual to sow discord and essentially question citizens of respective countries about sustainability of the transatlantic lines, especially the European Union, and of course sowed the discourse and mistrust in the local politicians. This has been ongoing, and until recently we continue witnessing the same effort. In particular, one particular narrative blames the invention of the virus either on the United States or certain other geopolitical enemies of the Kremlin, for example, Latvians or Lithuanians. However, there seems to be no one particular consistent narrative that is promoted, and frankly, since early on, this effort has not looked, at least to me, as being very well thought through. It seemed that early on the Kremlin really considered using this situation to continue like this hostile actions against the West. But as the situation started worsening in Russia, the very intentional direction of this disinformation campaigns seemed to actually get diluted a little bit. Simultaneously, as I show in my other research, the Kremlin, especially when the economic times are hard, tends to usually try to reestablish relationships with the West. That we also have seen throughout this pandemic, especially as the oil prices have really collapsed and the longer-term sustainability of Russia's budget situation becomes less and less clear. The effort to convince the West to lift the sanctions or use the pandemic as a pretext to remove certain sanctions on Russia has become very clear as well. So the Kremlin, for example, tried to pass the UN resolution about the necessity to lift sanctions, which failed. There is also effort to renegotiate with the President Trump, consisting recently communications and phone calls, provision of the assistance to Italy, the United States, and other countries in Europe and outside of Russia, again, trying to show Russia is the only benevolent actor today on this international stage, while the European Union actually fails to deliver and fails to provide for its own countries. As of now, it's not very clear if this effort will be successful, and we hope it will not be. But as the international community, we need to be aware that the Kremlin is definitely going to be trying to use this situation, and especially the rising hostility against China that's spreading amongst the Western countries in its own advantage, trying to use it in an effort to lift the sanctions that is really necessary for the Kremlin in order to sustain its long-term survival. And I'll stop here. Thank you.
Thank you, Maria, for that good overview of the situation in Russia. Next, we're going to head south a little bit to Iran. where Jim Phillips, Senior Research Fellow for the Middle East at the Heritage Foundation, is going to give us his view and his assessment of what is happening in that country. Over to you, Jim.
Thanks, Luke. Iran, which became one of the first epicenters of the coronavirus pandemic outside of China, is suffering tremendously, in part due to the mismanagement, the dishonesty, and the self-serving priorities of a dysfunctional dictatorship. Iran's Islamic regime initially denied that the virus would be a threat to Iran, and in fact, it bragged about how the Iranian government was providing protective equipment to China. Then it downplayed the threat for political and economic reasons, and that was very common around the world in many different governments. But what really made Iran different is how Iran has weaponized the narrative of the spread of the virus. It claims that the US is responsible for starting the virus through the use of a bioweapon that caused the pandemic. And now it's trying to exploit the health crisis by pushing for sanctions relief, despite the fact that US sanctions do not block the import by Iran of medical and humanitarian food and other imports. In fact, those are explicitly waived by US sanctions. Nonetheless, this is an ideological regime. It's going to respond in an ideological way. But what is clear is that the virus spread in Iran in large part because of Iran's close ties to China. And Iran then became a key conduit for the spread of the pandemic to the Middle East. Today, Iran's government claims that there's more than 92,000 cases of COVID-19 inside Iran, and that it's resulted in more than 5,800 deaths, although many public health experts, even in Iran, believe that the numbers are much higher because Iran, like many other countries, doesn't have access to the tests that would tell the real scope of this pandemic. So Iran's rulers initially downplayed the scope and delayed decisive measures to slow the spread of the virus in order to avoid damaging the regime's political, economic, and ideological interests. The government announced the first 2 deaths shortly before Iran's February 21st presidential parliamentary elections. And Supreme Leader Ayatollah Ali Khamenei accused Iran's enemies of trying to spread panic in order to dampen voter turnout. He knew that the regime was in deep trouble because of ongoing repression at home. Iran had repressed a huge outbreak of protests back in November over its price increases. The regime had killed an estimated 1,500 people in those protests, and more recently had squelched other protests after the Revolutionary Guards had shot down a Ukrainian airliner in January during the crisis over Iran's support for Iraqi militias rocketing Iraqi bases at which US troops were stationed to fight ISIS. So it's a very complicated situation for Iran. Iran also on February 25th, President Hassan Rouhani had refused to admit that the outbreak was quickly spiraling out of control, claiming that this was, quote, one of the enemy's plots to bring our country into closure by spreading panic. While the precise details of the spread of the virus remain unclear, it is clear that Iran became a hotspot due to its close ties with China, and that inconvenient truth has put the regime in a very awkward position. On the one hand, it constantly stresses that its close ties to China help it in its confrontation with the US. The two countries have staged military maneuvers, naval maneuvers, along with Russia outside the Persian Gulf. China continues to provide Iran with diplomatic protection at the UN. But it's clear that the outbreak in Iran, which first occurred in the holy city of Qum, and by the way, that's the Iranian city that is believed to have the highest number of Chinese expatriates living there, that it spread from Qum, not only infecting Iranians, but possibly tens of thousands of foreign Muslim pilgrims who went to Qum in the months before the shrines were partially shut down. Initial reporting indicated that the virus may have originated with an Iranian businessman who traveled to Wuhan, China, or perhaps a Chinese worker. There are several hundred Chinese workers reported to be working on infrastructure projects near Qum. But I think more importantly, there are more than 700 Chinese students at Qum Cemetery and the Al Mustafa International University. And these gave Qum the highest percentage population of Chinese in Iran. One Iranian Sunni scholar has charged that the COVID-19 pandemic originated with these Chinese seminary students. And that could be one reason the regime is very reluctant to acknowledge where the pandemic came from in Iran. In any event, COVID-19, as the cases began to multiply in Qum, the Iranian regime clearly failed to enact serious countermeasures to contain the outbreak. Religious shrines in Qum remained open, as the authorities initially balked at closing them, which would have reduced the income of the shrines and the foundations that run the shrines would have pocketed from the continued flow of foreign Muslims. And that's very important to Iran now under sanctions, any source of foreign currency. Even after Iran's health ministry called for the closing of the shrines, religious figures resisted the closure. They proclaimed that the religious shrines had divine powers that would help cure disease and inspire Iranians to resist the disease. Iran was also slow to halt air travel from China. It claimed that all flights ended on February 14th, but the flights continued on Mahan Air, which was a airline partially owned by Iran's Revolutionary Guards. They could be moving who knows what from China to Iran, so those flights continued. President Rouhani publicly refused to institute nationwide quarantines, calling them anarchic, and boasted of Iran's public health system. Regime officials bragged that Iran exported face masks to China and a COVID-19 outbreak would not be a problem. The regime saw an opportunity to repair its tattered image after repeated repression of its own people and the shoot down of the Ukrainian airliner. And that airliner, 176 people died. Most of them were Iranians. But the Revolutionary Guards lied for 3 days before finally admitting that it had shot down the airliner. So now the Supreme Leader has deputized the Revolutionary Guards and the army to lead Iran's national program fighting the virus. And I think this is a means by which the regime hopes to repair its image and shore up the public image of the Revolutionary Guards, which are basically the Praetorian Guards that keep the regime in power, and they're the ones that are responsible through their Basij militia of repressing Iranians on the street. Iran's internal propaganda mills have generated a very rosy picture for Iranian people, At the same time, its external propaganda mills magnify the outbreak in order to gain sympathy and sanctions relief. But Iranian doctors and nurses in overwhelmed hospitals report that they've been warned by security officials not to reveal the true extent of the numbers of infected, the numbers of death, and the shortages of protective equipment. Unfortunately, the Islamist regime in Tehran is more concerned about controlling information and controlling people than on controlling the virus. And I think that's evidence of its skewed priorities, including foreign policy priorities, in which it continues to spend billions of dollars propping up the Assad regime in Syria and spending millions to send to the Houthi rebels in Yemen, while it claims it doesn't have money to spend on its own people's public health. Security forces stationed in hospitals have threatened to arrest medical personnel who disclose information about the epidemic or the pandemic. And while public places such as schools and places of worship and most of the shrines have been closed down, Iranians have been put at risk by a very callous regime. And that's something they're very aware of. In late March, 100 Iranian academics and political and social activists published a letter that held Iran's supreme leader personally responsible for the epidemic becoming a national disaster. They charged the regime was not only responsible for concealing the scope of the crisis, but it failed to take measures to curb the spread due to political and religious considerations. They criticized Khamenei for preventing Iranians from receiving American or other humanitarian aid, while he and other officials had access to medical treatments unavailable to most Americans, to most Iranians. The regime not only has exposed its own population to increased risk from this pandemic, but it has spread the disease to other countries. Up to 16 neighboring countries and nearby countries have claimed that Iran was the chief source of the pandemic entering their country. So not only has a sluggish regime response hurt Iranians, but it's hurt the neighborhood. And Iran has tried to weaponize this information to hurt the US. The coronavirus crisis has become another front in Iran's Islamic propaganda campaign against the US, the Great Satan. The regime accused the US of unleashing a bioweapon. And in fact, the supreme leader claimed that in a public speech on March 22nd, claimed that the US created this virus, quote, it was produced specifically for Iran using knowledge about Iranian genetics that were acquired in various ways. Khamenei also rejected a US offer of medical assistance to help fight the epidemic. Iran's Revolutionary Guards have taken the lead in spreading propaganda. General Salami, commander of the guard, said that the virus is maybe the product of an American biological invasion, which first spread to China and then to Iran and the rest of the world. Dr. Ali Karami, a lecturer of medicine at an institution affiliated with the Revolutionary Guards, claims that the US has engineered a virus to develop what he called ethnic weapons that specifically targeted Americans. So Iran has called for a global fact-finding committee to investigate charges that the pandemic was a US bioweapon attack, and it's called for international monitoring of US laboratories. So you can see that Iranian propaganda has developed in close harmony with that of China and Russia when it comes to blaming America first for this problem. But some Iranian health officials apparently didn't get the message and they publicly criticized China for downplaying the extent of the pandemic, which caught Iran unawares when it spread to Iran. And this led to an unusual situation where Iran's foreign ministry denounced its own health officials. And it's clear why the foreign ministry will do this, because Iran needs China much more than China needs Iran. China is its biggest trading partner, its biggest customer for oil, and the #1 source of Iran's imports. So Iran has not allowed this crisis to go a waste. In addition to shifting blame to the great Satan, it's called for the end of U.S. sanctions. It's applied for a $5 billion loan at the IMF, which it hopes will come without any strings attached, so it can use those funds for other purposes. Meanwhile, the regime not only rejects help from the US, but also from Doctors Without Borders and other international health organizations. It claims that those humanitarian aid workers would be spies. And I think it shows you the depth of the paranoia of this regime. Iran is trying to borrow a page out of Saddam Hussein's playbook in the 1990s when he sought relief from US sanctions under the UN Oil for Food program. That program became a lifeline for the regime, which diverted some of the medical supplies to the black market, gaining foreign currency to continue propping up its security forces and continuing aggression outside Iraq's borders. Iran would do much the same. So I think the US should continue what it's done in the past. That's offer transparent medical help for the Iranian people, but not in a form that would prop up the Iranian regime. Because the bottom line is that this is a regime that really doesn't care that much for its people. In fact, it sees people as the Iranian people as the chief threat to its continued existence. And sadly, they put a higher priority on saving face than saving Iranian lives. And I don't think that will stop in the future. Unfortunately, once again, the Iranian people are the biggest losers of this crisis. And I'll stop right there.
Thanks, Jim, for that very detailed overview. Now over to Northeast Asia. Well, actually, really Washington, D.C., but to talk about Northeast Asia will be Bruce Klinger. So over to you, Bruce.
Thanks very much, Luke, and thanks to all of you who are watching. Hopefully I figured out how to turn on both my camera and my microphone. Since we sent out the notice for this event, the North Korean cover-up of COVID really has been superseded by the cover-up of Kim Jong-un, the North Korean leader. We don't know if he's dead, incapacitated, or he's doing fine. Thank you very much. But I'll stay with the original plan and talk about COVID, but I'm happy to talk about Kim Jong-un during the Q&A. To put the summary up front, North Korea has said still that officially there are no cases, let alone deaths in North Korea. None of us believe that. There was a lot of concern early on that given the very poor health conditions or the health industry, the medical system in North Korea, as well as the already emaciated and very weakened state of the North Korean populace, that COVID could really go through North Korea like wildfire. That said, right now it looks like they dodged a bullet to a great extent. We're already seeing indications that schools in Pyongyang are starting to reopen. We're not seeing the kind of reports as we saw in other countries of widespread infections, and certainly not satellite imagery of mass graves being dug. That said, we need to emphasize that North Korea really is, as we said at CIA when I was there, the hardest of the hard target. Compared to the other countries we've heard about today, Russia and Iran are open books. So we always preface a bit. But kind of going back to the beginning, there have been some reports that internally, North Korea authorities have talked to local authorities that there have been cases, but that hasn't been confirmed by the official media. They've talked about in these internal documents that there were cases in 2 provinces as well as Pyongyang. And the 2 provinces are, as if you think of a clock, down at 7 o'clock, way up at 1 o'clock, and then Pyongyang in the center of the clock. It's hard to believe that there weren't cases in between those provinces. And there have also been some reports from South Korean groups that have access to people in North Korea that there were at least 100 deaths of North Korean soldiers, that there was starvation, there were infections widespread, but we're really not seeing that in widespread reporting. And that could be because North Korea imposed very strict measures right after the outbreak of COVID in China. They closed their borders. They canceled all flights to and from Russia and China, which is the most travel that there is. And they even went to the extent of shutting down state-run smuggling operations across the Chinese border. And those have been used by the regime to make money and supersede the UN sanctions that were imposed after the nuclear and missile tests. So what we're seeing is that the trade with China, which accounts for 90% of North Korea's trade, foreign trade, was cut. And what that's doing is exacerbating already very tough economic conditions in North Korea. Back in December at a senior level meeting, even before COVID had really hit, Kim Jong-un had warned not only the authorities, but really the populace that they would once again have to tighten the belt after several years of promising that conditions would improve. So in a way, the self-imposed COVID measures that the regime put on itself was indirectly increasing enforcement of UN sanctions. China and other countries had gone around the sanctions, but both China and North Korea imposed measures that cut off the trade. So what this is doing is making it more difficult for the regime to get cash. And some of the other measures that they were doing was they've imposed a quarantine on all cargo that comes into North Korea. They have about a week or 2 quarantine on that. So that is also impacting the humanitarian assistance that is trying to get to North Korea. President Trump, and prior to that, the State Department had offered U.S. assistance on COVID, medical equipment, and the regime turned that down. But we've seen reporting that North Korea reached out to South Korea and China for, if not monitoring equipment, at least masks and gloves and other medical gear. So what we're seeing is that it seems that North Korea may have avoided the worst of what had been predicted on COVID, and that the humanitarian assistance, some of it is getting through from non-government organizations such as Doctors Without Borders and others. I think one thing to mention about humanitarian assistance, there's some who assert that the population is in dire straits, not only because of during the COVID, but prior to that, because of sanctions, the US sanctions, UN sanctions, and that's not the case. The situation is dire because of decades of socialist economic procedures and policies by the regime. There are no sanctions in either US or UN resolutions against humanitarian assistance or food or medicine. And in all US laws and UN resolutions, there are specific paragraphs which point out that these sanctions in no way hinder the provision of food, medicine, or humanitarian assistance. Now, what has happened is some of the assistance is sort of inadvertently being restricted, either because now North Korea is quarantining cargo coming in, including humanitarian assistance. The financial transactions, the banks themselves are increasing their due diligence procedures because of all the money laundering that North Korea, as well as other entities that were helping it, were engaged in. So the U.S. continues to offer humanitarian assistance, but right now the focus is more on what the condition of the North Korean leader is, and that is yet another information black hole. So I'll close it there, and I look forward to all of your questions.
Thanks, Bruce, for that overview. So now we have the question and answer time. I again ask you, if you have a question to propose, please submit it in the question box that you can find on your screen. Here's a question for Maria from a member of the virtual audience. Do you think that the Russians are hiding the number of cases of COVID-19 to avoid the appearance of a loss of military readiness?
Interesting. So I think the Russians are hiding the real number for all kind of reasons. So one very big reason is actually the lack of sensitivity of the tests. It's true that I personally know people who had to pass the test 4 times before it finally showed that they had coronavirus, even if they had all of the associated symptoms. So since early on, despite the fact that Russian tests have received the WHO approval, they are not. We knew that they are not sensitive enough. Second of all, of course, there is like this overall legitimacy questions. The authorities have to give the project the view, this look that they have things under control. And so that's why from the starters, the real numbers of the infected have been underreported. And most importantly, what's been done is since early on, unlike the reporting on the cases is very different from the way it's done in Europe. For example, in Italy, or if I'm not mistaken, New York, if a person dies from anything but had coronavirus at the time of death, the death is reported as a coronavirus death. As a matter of fact, in New York, I think they're revising it even to increase to include cases where coronavirus has not been confirmed, but there were the symptoms. In Russia, it's pretty much the opposite. If a person dies and had something else along with coronavirus, the death is typically reported until even now as a death from something else, like a heart attack or I don't know, diabetes or something else. And it was very, very telling the way the federal TV channels portrayed the early deaths early on. Essentially, they would honestly just list the number of associated diseases that the person had, and the coverage essentially was meant to show that coronavirus was hardly to blame for this death, given the associated complications. So this actually tells you that the real numbers are much higher. But it is true, of course, that there is also this international aspect of it. And by the way, the Kremlin has itself to blame for the dire situation with the army, because it actually procrastinated with delaying the celebration of the Victory Day on May 9th. That's typically takes place on May 9th every day, every year. This year, it was also supposed to be a very important date because it's one of the like important days, a certain number of years after the war. And because it delayed for so long the cancellation of the parade, a lot of military officers reportedly got infected. And so right now we're actually getting quite scary reports about the number of infected among the Russian military servicemen and officers. And this is definitely does not look good, even if the risks for the younger people are generally lower with COVID-19, still it's there. So I don't think the key aspect of this underreporting is necessarily Russia's projection of this military strength and power, but certainly is a part of the story.
Thank you for that, Maria. The next question is for Bruce. If Kim Jong-un is incapacitated due to COVID-19 or some other reason, what would happen to the command and control of nuclear weapons in Korea?
Well, as is the case often with North Korea, we don't know. It would really go to the successor, which is the subject of a lot of speculation right now. We don't know if he is dead or incapacitated, as I said before. And the rumors are that it's from a heart attack, it's from a failed heart surgery, or even injury from a failed missile test that he observed. South Korean officials particularly are saying he's fine. There are no concerns. He's simply isolating himself away from COVID, and perhaps one of his bodyguards had COVID. So the successor would have control. And right now, the speculation is that his sister may be the chosen one, but there's no formal succession plan in the North Korean constitution, as there was not during the death of the previous leader. Up until about 2 years ago, the consensus was that a strict authoritarian Confucian society like North Korea would never allow a woman to lead. But since then, in the last couple of years, Kim's sister has gained a lot of stature, a lot of authority, some very senior titles. So she's seen as the most likely successor. But there's really much about North Korea's nuclear strategy and the command and control that we don't know. But in such a centralized regime, it really would be the leader who has sole control.
Thanks, Bruce. And the next question is for Jim Phillips. Jim, has Iran's relationship with its elites and the PRC been damaged or changed in any way because of a change in public sentiments to China as a result of COVID-19? So basically, has the feelings from the man on the street, so to speak, is the frustration there being translated into maybe a shift or a change in policy between Tehran and Beijing?
I think just anecdotally, there has been evidence that the Iranian street looks at China a lot differently now than it did BC, before coronavirus. You know, there was a substantial amount of grumbling about cheap Chinese products that have flooded into the country, but the regime continued to value in the highest regard China's support, not only diplomatic but economic ties. In the past, before UN sanctions were put on, Iran imported a lot of Chinese weaponry. So it's clear that the regime sees its interests tied with Beijing. But Iranian people in general increasingly have turned against the regime. Even the core supporters, the urban poor and rural poor that received the benefits of some of the state welfare policies, those once were the core supporters of the regime, but since late 2017, even they have staged massive demonstrations against the regime. So I think there is a tide going out in terms of popular opinion regarding China in Iran. But you know, the regime calls the shots, so it's going to remain as close as it can to Beijing.
Yeah. Thanks for that, Jim. We have time for just a couple more questions. So if you feel the urge to ask, go ahead and type it in now before we run out of time for this webinar. The next question is actually back to Maria. Do you see Russia's information campaign having any effects on NATO or EU members that would diminish both NATO and EU as the preferred organizations to provide assistance against COVID-19?
It's a very interesting question. I think we need a little bit of a longer term perspective to be able to answer it well. But early on, especially late March, when before the situation got significantly worse in Russia, but was already developing quite badly in Europe, in Italy, for example, definitely there was the moment where it felt like Russia was getting some upper hand by communicating this message that the EU is weakened and unable to deliver, NATO also being impotent in the face of the situation, and essentially the EU members being left for their own sake to save themselves, especially in Italy, which has generally has been more susceptible to Russia's disinformation, as more political actors that tend to embrace pro-Russian views and positions. Yes, at the time, it felt like it could have given certain advantage to the Kremlin, but increasingly, as the situation got worse in Russia itself, and also as frankly the medical equipment that Russia sent to Italy and the United States actually has been has been found not necessarily useless, but quite controversial at the very least. The recent examples was actually the set of boxes with medical equipment, which were allegedly sent by the Russian Orthodox Church, by the Patriarch, to Italy. But for some reason, those boxes had these signatures on them that they were manufactured in China and only meant for use by Switzerland. And those issues like that definitely undermine the original intent and the Kremlin posture. Similarly, the medical assistance, by the way, that was sent to the United States was found to be largely useless. And of course, it was also shown that probably intentionally, was manufactured, at least in part by one of the Russian companies that's on the sanctions list. So definitely, again, shows you the intent to put this point across that we need to lift sanctions in order to be able to help each other in the midst of pandemic. So overall, yes, early on, it felt like Russia was getting some leverage in the midst of chaos imposed on the West by this disease, and very similar, frankly, in the way it happened with the war in Donbass and the initial annexation of the Crimea. It seems that the West just frankly takes time to catch up with Russia's approaches, and early on, Russia may have certain leverage because of the unpredictability and lack of organized effort to respond to it on the Western side. But typically, throughout the long term, the West responds quite deliberately, and I don't think, in this sense, coronavirus is going to be an exception. We see that none of the initiatives Russia has tried to push regarding the sanctions lift has been able to succeed so far. So we'll keep watching.
Thanks, Maria. It does seem that Russia has a special ability to take advantage of these situations. Bruce, the final question is for you. Can you elaborate on North Korea's health system and its ability to deal with an outbreak like COVID-19?
Well, even in normal circumstances, the North Korean health system is abysmal. When visitors go in, a lot of it is North Korea will either show a very positive or very negative view to try to either stimulate assistance or not. But people have commented that they lack even the most basic of not only equipment but of supplies. So that was one of the reasons why there was such great concern that there could be really a massive epidemic if COVID got loose in North Korea. And as far as we can tell, it hasn't. And that is more likely because of the very draconian measures that the regime imposed rather than because of the health system. So I had mentioned that they cut off travel across the borders. They even imposed very strict internal travel restrictions. Just one thing, getting back to the earlier question about nuclear weapons, because there's so much about North Korea we don't know, that's one of the reasons why there's a great concern about a succession occurring without a formal plan. There's the fears of an explosion, either in the sense of North Korea lashing out at its neighbors because of a perceived threat, or just to create a rally around the flag effect around the new leader, or an implosion of regime collapse, instability, civil war, warring factions, who has control of the nuclear weapons. So that's why, although we won't shed a tear if Kim Jong-un dies, there is a lot of concern and anytime there is a succession, as was the case with the previous ones. That said, we had those fears before and the regime perpetuated itself, and I think it's more likely that the regime would continue as opposed to either the explosion or implosion.
Thank you for that, Bruce. I would like to thank our panelists today, Maria, Jim, and Bruce, for participating, taking time out of your busy schedules. We're still busy at home, in case our bosses are watching. Let's make that clear. And thanks particularly to you, Maria, and SEPA, the people over at SEPA. It's great to have that collaboration again. And I want to thank everyone who's taken the time to log in and watch this. This webinar will be made available on our website at heritage.org within 48 hours if you want to watch it again. And I wish and hope that everyone remains healthy and safe during these times. So thank you very much, and thank you again to our panelists.